Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
Hey everybody, welcome back to the Wild Health Podcast. Mike Mallon here. We're going to be talking today about something that honestly I wish we talked more about on the podcast because it's extremely important, poorly understood, and an area that's just very interesting, and that's the microbiome. And to help me do that, I've got Colleen Cutcliffe, who is the CEO and co-founder of Pendulum. She's got about 25 years of experience leading and managing biology teams in academia, pharmaceuticals, and biotechnology. Before she started Pendulum, Colleen was the senior manager of biology at Pacific Biosciences and a scientist at Elon Pharmaceuticals. She completed her postdoctoral studies at Northwestern Children's Memorial Hospital. She received her PhD in biochemistry and molecular biology from Johns Hopkins University and her BA in biochemistry from Wesley College. Colleen, thanks for visiting us, and so happy to have you here to talk about the microbiome.
Thanks so much for having me.
So it's been a minute since we've talked about the microbiome on the podcast, although we have talked about it before, and the listeners are encouraged to go back and listen to previous ones. But just to catch everybody up to speed before we dive into all of the exciting new science, some of the science that actually Pendulum has helped create, if you could just kind of get us started with what is the microbiome and why do we think it is important for general overall health?
Yeah, sure. I think it's sort of hard to turn anywhere today and not hear something about either the microbiome or gut health. It's definitely becoming a part of our general vernacular. And I think what's been really exciting is that even though things like probiotics and yogurts have been on the shelves for decades and decades, there's this new science called microbiome science where, because of DNA sequencing technologies, we can now look at the, hundreds of thousands of different bugs that live in us and on us and start to delve into how do they play a role in our health? And it turns out that it's not just what we've traditionally thought of as, oh, probiotics will help me if I'm having GI issues like diarrhea and constipation, but actually the microbiome plays a pivotal role in our metabolism, in our immune system, in even our gut brain function, in our allergies, our asthma. And so there's just this growing body of evidence around how important our gut microbiome is to our overall health. And it's just been an exciting time to be in the space and be part of that discovery.
And the gut microbiome is just one of the microbiomes on our body. We've got a skin microbiome, we've got nasal microbiome. So humans have evolved to live with these creatures, and it's a symbiotic relationship in many aspects where we need them just as much as they need us in order to continue to thrive. Now the microbiome,
Sorry, I was just going to say, I absolutely agree with you. And, a couple of interesting things are that it feels like we're constantly trying to kill these organisms that we've co-evolved with. And so, we have this, layer of microorganisms that are supposed to be on our skin, to your point. And actually, one of their big roles is that they're supposed to be a barrier between the allergens in the outside world and our own immune system. So as we go through all of our regimens to clean our bodies and clean our skin, and we remove those microbes, what we're removing is a protective layer. And so now all of a sudden our immune system has to interact with every allergen out there. And we wonder why, our allergies are so much worse and why people have more asthma. And so I think there's just a lot that we are killing and inadvertently sort of, we're trying to be healthier, but we're actually making ourselves unhealthier.
right. I mean, the big reason why I've stopped using antibacterial soap and tried to stop, being as aggressive about washing my veggies, things like that. And I'd love to actually, if we have time, talk more about antibiotics and the gut microbiome as we move through our discussion here. That this microbiome that we're discussing, it evolves fairly quickly early in life. Is that correct? I mean, basically days after birth is when it starts to evolve, right?
Well, yeah, and actually, I think that early, even before birth and coming through birth, there was an initial theory, which was that when you're born, you actually have no microbiome, and then it all kind of establishes over time. But I think what people are starting to learn is that that's not actually true. Even when the baby is in the womb, that's not exactly an entirely sterile environment. There is some microbiome exposure, and then for babies that are born vaginally, as they're going through that birth canal, they are actually being seeded with a bunch of different microbes that are important for establishing both their skin and their gut microbiome. So it's a very kind of simplified version of your microbiome, and it becomes more and more diverse and more complex as you grow. But I think there's never really a point in which we have no microbes in us.
No matter how many antibiotics you've been on, there's some some microbes inside of you. What what how long does it take to change? Like it doesn't, it's not like you get your microbiome and it gets set when you're 10 years old and then it's like that for the rest of your life. We know that it changes and it evolves over your lifetime. Is this something that happens relatively quickly?
The beautiful thing and the curse of the microbiome is that, to your point, it's changeable. And so there are different things that can change it, and they take different amounts of time to change it. So we know, like when you're an infant, you have a few strains. Once you start getting introduced to food and you're eating, depending on the variety of foods that you're eating, then you start to get a more and more diverse microbiome. As an adult, and so your microbiome is sort of evolving over time. And as an adult, some of the things you can do to really disrupt your microbiome are you could take an antibiotic. That immediately decimates most of your microbiome. So that has like an immediate impact within, hours. And then you can also change your diet. So if you go from being an omnivore to a vegetarian, we know that it takes about 8 weeks, but at the end of that 8 weeks, your microbiome actually is reestablished and is different and has, evolved to now your new diet. And so if you're trying to introduce a new probiotic to your already existing ecosystem, that can take, longer than that. You're not doing a whole hog change. You're trying to do something into something that's already an existing landscape. We generally say like, give it 90 days. Some people can have an impact in a matter of a couple of days if there's like an open niche for that particular probiotic. And for some people it could take over 6 months because there's something about their system that makes it harder for these strains to colonize. So that part kind of really varies from person to person.
What sort of like lifestyle factors can we expect to impact the microbiome outside of obviously taking antibiotics? I imagine food is a pretty big one. You mentioned omnivores versus vegetarians, but do we need to be thinking about like organic foods? Is it locally sourced garden veggies that haven't been washed? Like what sort of lifestyle things can we do to improve the quality of our microbiome?
Well, I think what we've learned is that first of all, the diet is one of the most powerful ways that you can change your microbiome. So you have actually quite a bit of control over your microbiome through what you eat. So that's the good news. The types of foods that really feed the so-called beneficial or the good bugs are foods that are high in fibers and high in polyphenols. And so high fiber foods, fruits and vegetables, things like that, are actually providing the prebiotics that feed your probiotics, which are the bacterial strains. And so if you can be eating lots of high fiber and high polyphenol foods, that's really great for your microbiome. And then, conversely, processed foods tend to have a detrimental effect on your microbiome. Those are not things that can generally be processed by these microbes that have beneficial effects. And if you think about the fact that we co-evolve with these strains, it's maybe not surprising that these processed foods are more problematic for them than foods that they would, naturally see in the wild. And so I think those are some of the important things. One of the other lifestyle things, there was a study that was done actually at Stanford where they looked at people who had dogs versus people who didn't have dogs. And they found that people who had dogs actually had more diverse microbiomes than people who didn't. And it's because, generally speaking, dogs are out and about. They're rolling around the soil. They come in the house. We hug them. We kiss them. They lay in bed with us. And so they're actually transferring some of their microbes to us. And so having a diverse diet, we're eating lots of foods, trying to ramp up your fibers and polyphenols, and getting a dog. These are all good for your microbiome.
Yeah, maybe an argument for not taking your shoes off when you walk inside as well. Actually walking around your house with your shoes on, because that's basically what they're doing. They're
Oh
walking out
yeah.
on their paws, out in the dirt. They're walking back into the house. You're getting, dirt all over the place. And then next thing you know, it somehow ends up in your colon. Perfect. You mentioned,
Exactly.
you mentioned polyphenols. Just real quick, we don't need to go into too in depth, but you just mind describing what polyphenols are for the listeners and maybe where people can find those things in their diet?
Sure. So, a polyphenol, again, is this is a type of prebiotic that's been shown to be beneficial for growing a particular strain in your gut, which is called Akkermansia. We might deep dive into that a little bit later on.
Definitely.
And it's been shown to have a variety of polyphenols have been shown to have a variety of different health benefits. The kind of foods that have polyphenols are pomegranates have a lot of polyphenols in them. And green tea has polyphenols in it as well. And red wine and dark chocolate. So there are a lot of different fun ways to get your polyphenols in.
So tell me a little bit about microbiome testing. I heard somewhere recently that we have only speciated something like 50% of those bacteria that are in our gut. Is that true? And where are we in the world of science in terms of understanding these bacteria and how the individual different bacteria play good and bad roles in our own health?
Sure. Yeah. I mean, it's a great question because we really are in the learning phase on the steep part of the curve right now. All the probiotics that are kind of on the shelves, if you read labels, they kind of start with lactobacillus or bifidobacterium. Those are really only represent less than 5% of actually all the gut microbes that are in our guts. And so there's a lot left to be explored. 10 years ago, I would have told you we don't know 80 to 90% of the things that we're able to sequence. We don't actually know what they are. I think we've been learning a ton over the last decade. And so at this point, it's probably about 30 to 40% that we still aren't really clear on. So there's been a massive amount of learning in the space. And so, gut microbiome tests are therefore also in their infancy. And I mean, you've probably seen a lot of these tests cropping up all over the place. A couple of just sort of things to know about those tests is there's different ways in which those tests are run. And so that kind of gives you different quality of information. The
Yep.
second thing is that it's not regulated right now. So the sensitivity and specificity of those tests nobody is required to report any of that. And so you can get variability, especially if you're going with, one of the, kind of less rigorous testing companies. And then the third thing is it's really hard to know what's actionable from the results of those tests. So even if you thought the test was well run and you thought that the results were accurate, what do you do with those results? I think is a pretty tricky place. I think there will be a day where we'll know exactly what to do with those results. Right now, we're still pretty early stages on that front. They have their utility. For example, we know that butyrate producers are really important. So if you take those tests and you find your low in butyrate producers, you have an action that you can take from there. You can do things to try to increase your butyrate producers. And this other strain, Akkermansia, which I alluded to, which is emerging as a keystone strain in your gut, every one of these tests calls out Akkermansia. And if you're low in that, that's also actionable. So outside of those two things, though, I think it's kind of tricky to know what to do with the results.
Yeah, I mean, one of my pet peeves about microbiome testing, and don't get me wrong, I do microbiome testing on my patients like quite often, actually, especially if there's unexplained inflammation that we're trying to track down, or if they've got gut symptoms, and other reasons for that matter, autoimmune disease, things like that. So definitely there are clinical indications where it's important, but then I look at the results, and typically no matter which company you go with in terms of microbiome tests, you usually only get reported back maybe like 15, 20 different bacteria, right? And then if you look at the raw data from that company, there's like thousands and thousands and thousands of different bacteria that are actually reported. But my presumption is that those other bacteria are just, we don't know exactly if they're important or whether they have any influence. So we're really only reporting back on those that we do understand have some sort of influence. So to me, it's just like we're looking at just such a tiny percentage of the actual, microbiome itself on these patients. And then beyond that, prior to you guys, there's only two different probiotics that you can actually give somebody. It's either bifido or lactobacillus, and And on top of that, it's fiber. It's like, okay, great. So I'm going to give this person some fiber and some probiotics. Those are my two options. So it's nice. I say all that to say it's nice to see some new things on the market that are addressing some more specific disease states and are trying to be a little bit more meticulous about improving the microbiome itself by going after some of these keystone bacteria, for example. So I think now is a great time to talk a little bit about Akkermansia, which is, I know, a big part of y'all's product, and understand maybe we can start with, what is a keystone bacteria in the first place? Why is that important? And why is Akkermansia important?
Sure. I love that you're, as a practitioner, sort of helping to using these gut microbiome tests in conjunction with symptoms and other, diagnostics to figure out a game plan. Because I think that's the other thing I usually tell people when they ask me about taking gut tests. I tell them, you got to find a practitioner that knows what to do with that data. Because by itself, it's not as helpful as if you're trying to solve a specific problem. And to your point, there are problems outside of just pure GI issues that we can now start to address through the microbiome. And so Akkermansia is one of these strains that has emerged as a keystone strain because of what it does. And I don't think there's like this long list of keystone strains out there, and now we've just added one to the list. I think this one might be the only one that I've ever heard referred to as a keystone strain. And the reason is that it basically plays two super important roles. The first is that it plays a really important role in our gut lining. And so our gut lining can be thought of like a fence. I actually have a wooden fence in my backyard. There are these wooden planks, and they're held together by glue. And what can happen over time is that you started with a bright, shiny fence with great glue. Over time, through wear and tear, that glue can start to, thin. Those planks can start to fall. And our gut lining is exactly the same way. We literally have these planks that are held together by this glue, which is called mucin. And Akkermansia is the only strain that we know of whose job is to live at that fence, that gut lining, and strip away the old mucin when it gets old and replenish and give new mucin. And so it is really the regulator, the gatekeeper of our gut lining. And that makes it a keystone strain because we know that having a strong gut lining is pivotal to a variety of different things. So when you have a weak gut lining, what some people refer to as leaky gut, it means that you have this thin mucin layer and you have gaps between your planks. And so these small molecules can actually exit the microbiome where they're supposed to be housed and get into the bloodstream. And that includes things like pathogenic bacteria, which can lead to inflammation and immune responses. It actually is small molecules that can trigger your own inflammatory and immune responses. It's things that can lead to cardiovascular issues, things that can lead to kind of disruptions in gut brain. And so all of a sudden, when you have a gut lining that is not properly fortified and regulated, you have all these other issues cropping up. And that's why actually the majority of studies around Akkermansia have been, hey, we looked at sick people and healthy people, and the sick people are low or missing Akkermansia. And it's across a huge number of diseases, from obesity to neurological diseases to, IBD. And so that's one thing. So that in of itself makes it a super important strain. But it also has this other function, which is core to our metabolism. Akkermansia and one other strain are the only strains that have ever been shown to be able to stimulate GLP-1 production. So GLP-1 is a small molecule that has recently become, famous or infamous, however you want to think about it. And it's a super important small molecule because it plays a role not only in helping our body metabolize glucose, but also in messaging to our brain that, hey, we're full and we don't need to eat any more food. And your body naturally makes GLP-1, and it's your microbiome that naturally makes GLP-1. And so what happens is when you eat foods, your microbiome metabolizes those foods. And one of Akkermansia's jobs is that in the process of metabolizing foods that have sugars, it basically triggers these L cells, which are in your microbiome, to then produce GLP-1. So normally you eat food, your Akkermansia stimulates production of GLP-1 that goes up in your bloodstream, that tells your body to release insulin. So we just ate food, let's get rid of all the sugar in our bloodstream. And then it also tells your brain, hey, we just ate, we don't need to eat anymore. And And so the GLP-1 in your bloodstream will go up, and then eventually it'll go back down until the next time that you eat, and it stimulates this response. And so what happens is that people who are obese or have prediabetes or type 2 diabetes, or frankly, people who are aging, one of the hallmarks of that slower metabolism is actually a reduction in how much GLP-1 your body's producing. And then if you backpedal a little bit more, it's this reduction in Akkermansia. So you're losing that signaling that says, we just ate, let's produce GLP-1, and now let's process the sugars and let's give a feeling of fullness. And so that makes Akkermansia, these two roles in the gut lining and the stimulation of GLP-1 means that it plays a role in your metabolism as well as your gut lining. And that's why I think it's such an exciting strain that people have gotten really fired up about.
All right. So lots of stuff there. Let's
Yeah.
break down this 2 point. No, that's great. I love it. This is what I'm excited about. So, so the gut lining aspect, leaky gut, totally understand that, makes complete sense. If you've got these tight junctions in between cells, those junctions start to break down. Now you literally have crap getting into your bloodstream, and that causes inflammation. I think everybody can understand that. What's interesting to me is that it's almost counterintuitive. The Akkermansia eats the mucin, but then that upregulates the production of mucin. So I would if I had just read that in a paper, and actually the first time I did ever read this in a paper, I was like, oh, it sounds like Akkermansia is a bad thing because it's eating the mucin. But the theory is, at least physiologically, what's happening is it's upregulating production of mucin because it's eating old mucin, and then that new mucin is now helping protect that layer. Is that true?
That's exactly right. Akkermansia actually has a surface protein on it that binds to these TLR2 receptors. That stimulates our goblet cells to produce more mucin. So you can tell me when we're getting too deep into the nerdy science here, but
No, I love it. Just a little bit,
and
of nerdy science.
And so Akkermansia is really doing both of these things. It's consuming the mucin, and then it is also directly responsible for production of the new mucin. And so you're right. But that's why I say it's the gatekeeper. It's the regulator. It's doing both of those at the same time.
Mm-hmm. And this is a huge area of microbiome management, or functional medicine, integrative medicine. Whoever's working on colonic health, people are constantly focused at treating leaky gut and ways to improve leaky gut. So this breakthrough of now we can actually give people Akkermansia could be huge for this area of medicine for sure. The other area that I just want to dive into a little bit more is around the metabolic effects. So it sounds like we're actually seeing that Akkermansia is producing GLP-1, which is this molecule that is everybody's all excited about for Ozempic and all the other medications out there that help you lose weight. But it is literally producing a molecule to tell your brain that you're full, for all intents and purposes, right? Or that you've eaten and you don't need to be hungry and eat anymore. So presumably those people who do not have adequate amounts of Akkermansia in their gut are going to have less signals going to the brain saying, hey, we've just eaten, you don't need to eat anymore. That's my the obvious presumption. Is this correlative or causative? I guess is my question. Is it the loss of Akkermansia in our diet or in our microbiomes that has led to the obesity epidemic? I mean, I'm sure you can't answer that question, but it just makes me wonder, is this one of the huge problems, which I presume is from processed food and not getting adequate, microbiome health from a natural diet. But this sounds like a pretty big topic and an area that could be huge in terms of the cause of obesity throughout the country right now.
Yeah, and I mean, I think you are exactly right, and that's why I think people are so excited about this discovery. And the obesity epidemic is multifactorial, of course, super complicated. But I think the fact that people have started to discover, not only in the U.S. but around the world, this correlation of this loss of Akkermansia as we age and as we develop metabolic syndrome was sort of the first thing. So to your point, that's correlative. But now that you can do things to increase Akkermansia directly, there are now ways to know that actually that solves the problem. And so, and we sort of did our internal test where we showed that and this is maybe embarrassing that we didn't study this on our own in our clinical trials, but we had customers telling us, hey, I'm not like interested in any of the stuff that the Akkermansia does, except that I know that when I take it, I have reduced food cravings. Like at the Christmas party, I used to be the guy sitting down and eating all the cookies, and now I can walk by it and not, eat a single one. And so we actually did a follow-up study to that, and we found that 90% of people that had been on Akkermansia for 90 days had reduction in food cravings using the food cravings index diagnostic test. And they had reduction in food cravings across all 4 different types of cravings, which includes sugar, and that was actually the biggest one, fats, high fat foods, and now I can't remember the fourth one, but basically this diagnostic test has 4 different types of categories of foods, and people had lowered food cravings across all 4 of them. And so I think that is very much in line with the GLP-1 effect, to your point. So I think that even if it's basically a new tool to fight obesity and food cravings.
So that's really interesting. What sort of time frame were people on the probiotic before they had the reduction in food cravings? Did you have to be on it for a certain period of time, or was it almost instant?
Well, as you might imagine, as a practitioner yourself, that it depends.
Yeah, of
And
course.
so it varied from person to person. We kind of set it at 90 days, and that number that I just quoted to you, the 91%, was after 90 days of being on the product. But there were some people who started to have those benefits, a very short amount of time.
Okay. Interesting. So in terms of that, I looked at the Akkermansia data yesterday in preparation for this podcast, and I'll admit that I had known about Akkermansia previously, but not as much as I probably should have. And the data is astounding, at least the correlative data for disease, with associations to like literally almost every single chronic disease I can think of is the lower levels of Akkermansia, higher levels of disease, right? Is the correlation that we keep seeing. What I didn't find in the research was much in the way of implied causation, right? So there wasn't much in the research in the way of if you give people Akkermansia, then the disease improves, right? But it looks like you guys have published very recently a study on this with regard to glucose control. Can you tell us a little bit about that?
Yeah, absolutely. We've really been focused on this gut metabolism axis. The foods that you eat are digested by your gut microbiome. They're actually, when we talk about these high fiber foods, we actually don't encode for anything that can metabolize those. It's your microbiome that's metabolizing those fibers. And so if you don't have those microbes, that fiber that you're eating is literally going right through you. And so our whole thesis was, okay, if we could give people back the ability to metabolize those fibers, that would enable them to have the proper glucose response. And so the publication that you're referring to is in BMJ, and it's actually a formulation that contains Akkermansia, but it also contains 4 other strains, which are involved in sort of this multi-step reaction of metabolizing your food and helping you metabolize basically sugars and carbs better. And what we found in this study was that we gave it to people with type 2 diabetes. Most of them were already on metformin, and it was a placebo-controlled double-blinded randomized trial. And what we found was that after being on the formulation for 90 days, compared to placebo, the people who were on formulation had a lowering of their A1C by 0.6 points. And that can mean the difference between actually having diabetes and not having it, and a
Yep.
lowering of their blood glucose spikes by 33%. And so it was a, pretty exciting moment for us because it is the first and only time that someone has demonstrated that you can actually lower A1C and blood glucose spikes through a probiotic formulation. And, Akkermansia is one of the key strains because in that study, we had an arm which did not have Akkermansia in it. And while we saw some efficacy, it wasn't as big as when you included Akkermansia. So it's a big part of that metabolism story.
Yeah, that's really huge. I mean, zero point 0.6 of your hemoglobin A1C. So, like that's for example, if you were, if your hemoglobin was or your hemoglobin A1C was 6.2, and you took Akkermansia, then now it's down to 5.6. Am I doing that math right? That's a lot of math. And then
Yes.
you now no longer have diabetes. Like, congratulations, right? I mean, it's pretty impressive. And I when I looked at that study, one of my first questions was, what was the level of health of these patients? And it was moderate. I mean, their hemoglobin A1C average was around 8.5. So they weren't completely off the charts. Like whenever I look at a study like that, one of my first thoughts is, are they cherry picking those people with hemoglobin A1Cs of like 12 that you can literally like look at them differently and that'll improve. And you didn't. Like they were very moderate diabetics. And not only that, I also really appreciated that you looked at more than just hemoglobin A1C. You also looked at a glucose tolerance test, which I think most people who listen to this podcast know that is probably a better marker of insulin resistance than hemoglobin A1C is. Hemoglobin A1C obviously is the industry standard at this point for diagnosing disease, but I prefer the GTT for really understanding insulin resistance. And there was a significant reduction in the duration of elevated glucose and the height of elevated glucose after treatment with these probiotics, which I find not completely surprising, to be honest, because we know the importance of the microbiome in terms of metabolic health, but the degree to which the effect occurred, I thought was pretty remarkable. Pretty impressive stuff.
Thank you. Yeah, I mean, it was definitely exciting to, you're blinded to the results until the very end. So you just sit there and, chew your fingernails and say prayers every night. Yeah. Cross your toes, cross your fingers. I think what's been really interesting from my perspective is that we have a lot of people on that product that don't have type 2 diabetes. So people with prediabetes also reporting a benefit, but maybe even more kind of surprising, people who are in all intents and purposes healthy people have gone on to pendulum glucose control and seen their A1C lower. And so, people like Dr. Kara Fitzgerald, Dr. Peter Tia, I mean, these are people who are living healthy lifestyles, but, are very interested in, their A1Cs and things that they can do to manage that, especially as we age and think about, what happens to our metabolism during aging. And so you can be somebody who is doing all the right things, eating healthy, working on all the different components of, improving your, healthy aging process. But you may have lost these strains through things that are outside of your control. And so simply replenishing them can even benefit people who are doing all the right things in every other aspect of health.
So should everyone be taking Akkermansia? I guess is the question. When do we decide? Yeah, when do we decide like this is the person? Like, clinically, I'm stuck with this question, right? I've got patients in front of me. Clearly, with this data, this would suggest that anyone with an elevated hemoglobin A1C, insulin resistance, should be somebody that should be considering, supplementation on. But I can't put everybody on it. So when should I be reaching for glucose control versus some of your other products like just straight Akkermansia or metabolic daily, I think is the other one.
Yeah, I think that, so first of all, full disclosure, I'm on Pendulum glucose control. I don't have prediabetes or type 2 diabetes, but I wore a continuous glucose monitor. To your point, I find that data to be, first of all, you get a ton more data. And also for somebody who doesn't have an elevated A1C, you might see something. And I did a placebo test on myself. I told the lab, like, don't tell me which one's placebo. And I actually was blinded to my CGM data until the end. But I actually knew when I was on product because my workouts were stronger. I just had more energy during my workouts. And at the end, when we looked at the CGM data, all of my spikes and crashes were actually minimized, even though I don't have metabolic syndrome. As part of aging, I think this is just sort of what happens. And so, and I don't need a CGM to tell me that my metabolism is slowing down. I'm aware of that. But what I could see in my CGM data was that what this formulation was doing was actually minimizing that. So I would say that if you've got a patient who either has full-on type 2 diabetes or you're trying to manage their blood glucose spikes, that formulation is sort of the full dose that, you have the best chance of seeing an outcome with. And it's expensive and it has to be cold chain. So it's it is a pain in the ass product, but that is where you have, your best chance of seeing those outcomes. That's where we've done a lot of our clinical trials on. If you've got somebody who, is trying to metabolize their sugars and carbs better, but you don't necessarily want to give them that full dose, metabolic daily is exactly the same strains, but just at a lower dose and therefore actually at a lower price point. And so, that one is sort of for anybody who is trying to replenish these strains, but they don't necessarily want to go all the way to that high high dose of Pendulum glucose control. And then you as a practitioner are really well equipped to say, okay, if I don't want to give someone these full formulations, I suspect they're just low in this one strain. That's when you might decide to give someone just Akkermansia. So you might be combining things you know about their symptomology with potentially a gut test, which
Right.
says, okay, you've got elevated A1C, but you're also just looks like you're just low in Akkermansia. Let's just give you that because I don't want to give you more than you need. And so let's just start you on Akkermansia. So those are kind of the different scenarios in which you might go for, the different products. Does that help?
That does help. Yeah. What are there any people I shouldn't give Akkermansia to? Like, are there any contraindications to probiotic supplementation?
I think that kind of the number one thing that we do hear back is actually it's both sides of this coin. Most people come back and say, "Oh, this has actually improved my digestion and my GI symptoms." But there are some people who actually have the opposite impact. So it actually they have negative GI impacts, and that could be either from the capsule itself. So we do have an acid resistant time delayed release capsule, and that's so that the product can get through the stomach acid and to the distal
Hmm.
colon, which is where it needs to act. But some people have a reaction to that. And for that, we usually tell people, hey, make sure you take it with food because that can help with that. And then some people, if you are low in Akkermansia and it's been low for a long time, kind of jolting your system with a new strain can in and of itself have a negative effect on GI. And so in that case, we sort of say like, space it out. So take it every few days or, one a day or one every other day. And that might help as well. And so that's kind of the biggest one. Now, I will also say, Akkermansia was only really discovered, in the early 2000s. And while that may feel like a long time, that's a nanosecond in the context of understanding science and medicine. So it is still a new strain that we are still in the process of discovering and learning more about. So I'm not going to sit with you here today on say there's no amount, there's no person that shouldn't take it. I can say to date, that hasn't been discovered, but it is possible that we'll find there are certain people that shouldn't take it, at some point in the future.
Are there any specifics? You mentioned briefly that you should take it with food to help reduce symptoms associated with it. I guess I'm presuming like bloating or gas, things like that some people might feel. Does it matter what time of day, types of food, things you should have like? Do you have to avoid hot drinks or carbonated drinks, things like that, or what? Any more high maintenance things about how to take it?
Well, I actually, I take my pills in the morning with my coffee. And, that's all perfectly fine. There are, when we've done our studies, we often tell people to take one in the morning and one in the evening. And that's just because people have different eating habits and also they have different, kind of the amount of time that it takes your food to digest can vary from person to person, and so that kind of allows you to kind of hit at the two ends of the day. But really, to be honest with you, I think the most important thing is to take it at a time where it can be integrated into your lifestyle and you can remember it. And for me, that's the morning. By the time the end of the day rolls around, I can't remember, what I even had for breakfast, much less any kind of new regimen. So, it's really about the consistency of it. And then as I mentioned, there are foods that you can eat that can also help bolster these strains. And so if you are able to integrate things like, pomegranates and blueberries and, red wine into your diet and increase the polyphenols, that's been shown to also increase Akkermansia levels.
What about fiber? Do you need to eat certain types of fiber in order to help increase the Akkermansia, or is polyphenols really the primary thing we're thinking about?
Yeah, that's a good point. High fibers also can help. It's been shown that people moving to a high fiber diet that can help increase your Akkermansia levels. I mean, y- truthfully, I don't think you have to do any of that. I mean, all of our studies we actually deliberately tell people don't change your diet so it doesn't convolute our data. But those are the kind of things that can help you jumpstart and also help you colonize the strain so that you don't have to keep taking the pill for the rest of your life. So if you want to get the biggest impact in the shortest amount of time and then potentially not have to stay on the strains, on the pills, you should pair this good nutrition with the probiotics, which would be high fiber, high polyphenol, reduction in processed foods.
Yeah, I'm a big fan of inulin. Inulin is a great source of fiber for most of these bacterias, which you can find in artichokes and onions and garlic and bananas, which is probably the only reason to eat bananas in my book. But there's lots of different places you can find inulin, or you can take it as a supplement if you want, which might be, I think inulin might be in that. Is it in the capsule as well? I think, didn't you guys put some sort of fiber in the capsule?
We do. We do. It's not to the recommended dietary dose. So
Right.
if you're really trying to bolster your inulin, it's not going to do that. But it's a very small amount in the pills, and it's really intended for those strains themselves, so that when the pill does dissolve and the strains, come to life, they've got their food right there with them. I sort of liken it to, if you were going to drop me off on a deserted island, I would like to be dropped off with a cooler full of sandwiches and beers. And so the inulin is their sandwiches and beers, so they have something to eat when they first come back to life.
Okay. So you mentioned this briefly, but I want to hammer in on this for a second. So it sounds like there is the opportunity to colonize with Akkermansia, taking these supplements, not just support with the supplement itself. So presumably, just taking the pill, that Akkermansia that's in the pill could, release some GLP-1 and, eat some mucin for me and do all those things that I need it to do. But ideally, where I really want to get to is I want to increase my level of Akkermansia in my colon, so that, hopefully I don't have to take this pill forever. Is that something that you have seen in the data, that where you've seen actual percentages of Akkermansia in microbiome tests in your subjects actually increase over time?
That's something that actually we've been studying a lot with various collaborators. We saw in our study that we did a washout period where people didn't take anything for 30 days. And most people don't have the strains after that amount of time. But what's really interesting is about 15% of them did. They still had the strains even after they had stopped taking them, ingesting them. And so that got us really curious about, well, what is it about these people's either starting microbiomes or behaviors that, might lead us to understand who could colonize the strains and not have to take them anymore. And it turns out, unfortunately, it wasn't as simple as knowing, oh, your starting microbiome looked like this, so therefore you were more able to colonize. And we didn't do diet logs, so we actually didn't. We asked people, please don't change anything else about your life.
Question. Yeah.
What do they eat? We didn't do diet logs because my chief medical officer said diet logs are the best way to confuse yourself, because people log when they're having good days and they don't log their bad days, and then the data is like really just compromised in general. I think if we had been clever, we might have integrated an app that actually helped us get more accurate results than somebody kind of self-logging. But in any case, we didn't do that, but it got us curious about that. And we've had several practitioners come back to us and say, hey, when I do these gut tests, I find that if people are actually able to stick with a higher fiber, higher polyphenol diet, that they can kind of go off the pills and be able to maintain high levels of Akkermansia. And so we actually have some studies that are ongoing right now to understand, what specifically is the diet that can help people with this. And but I always tell people, logically it makes sense. These are the prebiotics that are going to feed the strain. You might have lost the strain over time through things like aging and stress, and for us women, menstrual cycles and things like that have all been shown to deplete your Akkermansia levels. But once you replenish the strain through the pills, if you can maintain a good diet that feeds that Akkermansia, you ought to be able to go off the pills. Now, life is going to introduce stress, and for us women, we can't get out of our menstrual cycles until we go through menopause, which then also reduces the diversity of your microbiome. But so you might have to go back on them at some point in the future. But if you can actually feed them, you shouldn't have to stay on them forever.
Awesome. So with the quality of data that you guys are presenting, I got to ask, are you considering FDA approval for the glucose control?
Oh man, that was a big conversation. We got those results back. When we started the company, philosophically, we always wanted to be selling directly to consumers. And there's two reasons for that. One is that I really believe that if you are providing a product directly to the end user, that allows you to make a better and better product because you're getting the immediate feedback. If you sell a product as a drug, which goes through a doctor, you kind of lose that direct connection. And in other words, if I'm selling directly to the person who's using it, I'm trying my best to have efficacy for them. If I'm selling a product through the FDA drug route, I'm trying to, my customers now, the FDA and physicians, and there's just a different incentivization. But the second reason, which is maybe more important, is that when you go through the FDA for a product like Pendulum glucose control, on the other side of that, people can only get it through a prescription, and they can only get it if they have the disease that you've called out. So it would be limited to people who have type 2 diabetes, who'd have to go to their doctor to get a prescription. Whereas if we sell it the way that we are now, it kind of democratizes the availability of it. And I think that, I don't want to slam, what are wonderful establishments in our country, but frankly, our ability to metabolize glucose is something that is super important for being healthy and healthy aging. And I don't think that you should only be trying to go after it once you've been diagnosed with type 2 diabetes. And so by selling it directly to people the way that we are, you can start to prevent this. You can start to tackle it when you're younger, when you just started on the obesity, before you've gotten all the way to type 2 diabetes. And again, as I said, as you're aging. So we actually can make it available to everybody. And so because I want to learn directly from the person who's using it, what impact they're having, and because I want everyone to be able to have access to it, we are not going to go down the FDA drug route for this particular product.
I appreciate that, because ultimately it would make it a lot harder to get to my patients. Even if some of them could get it covered by their insurance, the majority of them wouldn't be able to, because it would take forever to get it approved. Then I think you bring up a good point that only those people with the diagnosis would be able to use it, which is, same problem that we have with many other drugs or devices for that matter. For example, like continuous glucose monitors. So yeah, I think this makes a lot of sense, and I support y'all's decision for sure. This has been a great conversation.
It is something. I was just going to say, it is something you question, because we could charge a lot more if we made it a drug. And some people think that if you go through FDA approval, that means that the thing works. And if you don't, it doesn't. And so we really rely on people like you who are able to look at the raw data and say, actually, I think this thing could work, to really help educate, everybody else who's not sitting down and reading the primary literature.
Right. Well, this has been a great conversation. I really appreciate you coming on the podcast. I'm sure some of our listeners are going to be interested in learning more. Where should we send them if they're interested in learning more about Pendulum?
We would love to hear from anybody that has any questions. If you go to our website, pendulumlife.com, we actually have a bunch of resources on there, including, publications, the latest and greatest research on all these strains and how they work. And so would love for people to come to pendulumlife.com and ask any questions that you've got. And if you're a healthcare practitioner, we actually have a special section for you. And so you can get in there and actually get a deeper dive into the clinical trials and then protocols and when to use different products at different times. And most of those protocols were actually not written by us, but actually written by healthcare practitioners themselves. And we're just sharing out those protocols for everybody else. So would love to have people come visit the site and learn more.
And if you're interested, you guys did create a discount code for our listeners. Wild Health 20 gets them 20% off of your supplements. And I will also agree that the website's a great place for practitioners. That's where I got a lot of the background information that we use to help come up with questions for this podcast, because you guys put the science out there for everybody to look at, which is awesome. So, Colleen, thanks so much for coming on. This has been awesome.
Thank you so much for having me, and I am looking forward to hopefully talking again soon.
All right.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.